We now know that the law that was, as Carl testified, was to address the uninsured, to bend the cost curve, to change dramatically health care, is not saving money. It's actually not going to create nearly as much coverage as they expected.
You mentioned reduction in premiums in Massachusetts of 23%. Is that just a portion of the market? Because our information is the premiums actually went up 40%.
That was a reduction in the individual market. Their premiums in the small group market went up about 0.4% when they merged the two.
Could you get that information to us, because I've gotten just the opposite. I've gotten an increase in premiums of 40%.
Yes, I can provide you a site to the Journal Health Affairs.
Okay, that would be appreciated.
The bottom line is, in my view, is that the government bureaucracies do not do jobs of the private sector very well. And what I see as these healthcare exchanges is just another government bureaucracy by which decisions about what's available and what's not available that ought to be ought to be determined by the private market. They're holding up the signs, aren't they? I can feel the breeze fluttering down. So anyway, I would like to have a private market out there by which, and candidly, legislators, I speak this respectfully, I'm tired of you guys telling my health insurance company what they have to cover. I would really like to do it. Thank you. Hold your applause. Hold your applause. I would really much prefer for me to negotiate that with my health insurance company and not have to pay for the sort of things that I may not personally think I need, or to have available riders that I think would be more appropriate for my particular health care need.
I think many people are very concerned because we have no requirements, for example, in Missouri that maternity care be covered. My students and I looked at 72 policies in the individual market that are available in St. Louis, and not one of them covers maternity care.
The people here need to do everything they can to send a message that stopping whatever the governor is doing is necessary, and then we need to examine this. My encouragement would be not to do it, but certainly it shouldn't be done by bureaucrats in back rooms and by this governor.
Ed Martin called folks who work for the state backroom bureaucrats, and I've been in business in the state 32 years. I deal with state agencies and regulators all the time. They are delightful, intelligent, reasonable public servants that I deal with. It is a pleasure to deal with most of the time with the state of Missouri. And they're enforcing the law and protecting all of us.
First, I'd offer my testimony and offer my encouragement to you as a citizen and say that I believe that the implementation of the healthcare exchanges is wrong. It's not appropriate to do now, and I encourage the Senate to stop the governor and stop anyone else within the state apparatus who is implementing these healthcare exchanges, and do it immediately.
I understand that there are many people that don't want to have a mandate put up. I understand, I get it. But the problem is we need insurance. How do we get that? And that's where there is no other alternative plan out there. To be honest with you, it evolved down to this plan, which is the Ryan plan, the path to prosperity. All it says in there about us is the state maybe oughta, shoulda, at some time could maybe do something for us. There is no plan on the other side.
I've usually been able to find reasonable, affordable health care for myself and for my family, what I consider affordable. However, I will say this, affordable is in the eyes of the beholder. My health care costs about, the payment for a new car, okay? And I've never owned a new car. I've always made decisions, financial decisions, to give up some things to get something that I think is a more responsible purchase.
To those who say that insurance companies will increase premiums if we implement the insurance exchanges as a step toward Obamacare, Romneycare, it should be pointed out that such companies already benefit by the absence of any controls on the health care plan which is envisioned by the health insurance exchanges. At present, insurance companies in Missouri have no requirements to justify their premium increases.
I employ 6 people, including myself. And in 2007 to 2008, my health insurance costs went up 25%. 25% for a business that employs 6 people. When I try calling an insurance company, to bargain, what sort of leverage do you think I have when I'm just 6 people? Nothing. They'll hardly give me the time of day.
And our healthcare shouldn't be set up based on who's in control. But based on who's in control, some of the literature that will be dispersed could be designed to push and persuade people to agree to forego intensive medical treatment because it's a financial burden to society. And I want to quote something that President Obama said in the spring of 2009 in a New York Times Magazine interview that he did. And he said, after, quote, a very difficult democratic conversation about treating those toward the end of their lives who are accounting for potentially 80% of the total health care bill out here, end quote. And as a result of that, we've got these federally mandated health insurance exchanges that are going to be forced on us with health care rationing.
And as for the Right to Life woman, I didn't catch her name, who talked about insurance rationing. I deal with healthcare rationing. I deal with healthcare rationing every single month when I get my insurance bills. And right now, the insurance companies are rationing my employees' healthcare, and I'd much rather have a system into which I, as a taxpayer, I, as a citizen, I, as a voter, have some input. But I spend time that I could be making money, creating jobs, creating taxable income, on the phone, pleading with health insurers, who I'm paying, to cover costs my employees' doctors, who are in their system, have okay.
The state also has a pool that you're entitled to, if you're coming off of COBRA or whatever else, that you can go into the state pool. So there's not one resident of the state of Missouri that cannot get coverage currently in the state, healthcare coverage.
Right now I'm unemployed, and unfortunately, not only am I unemployed, but I don't have access to COBRA because I worked for a small business that was hit hard by the economic downturns, and when they had to lay me off, that also meant that they no longer qualified for group health insurance coverage. So I know a lot of the people are saying that, oh, you can just go out on the private market and get health insurance, or you can go to the Missouri Health Insurance Pool. But that really doesn't work. I have a lot of pre-existing conditions.
We lost our group health insurance and we had to try for individual. We went to every insurance company who turned us down. And basically it was for little things like my son had ADHD and I had high blood pressure. None of us was ill.
I also want to point out, I often talk about exchanges as the Expedia of health insurance because that's how most of us will experience it, a web portal where we can compare policies. The name exchanges was coined by the Heritage Foundation when they proposed this new idea a number of years ago, and that's a direct reference to the stock market exchange, which functions much like we want a health insurance exchange to function, to set minimum quality standards so consumers know they're not buying junk, not being flim-flammed, they know what they're getting, to create a one-stop shopping place where people can see all of the options that are available.
As a true entrepreneur, where we started with one person and after 25 years had 150 employees. We're a manufacturing business. We manufacture daycare equipment and sold it all over the country and all over the world. The most difficult thing I had to deal with was health insurance for my employees. It is not easy to compare health insurance plans the way they are set up now. I think an exchange would make it so much easier for a business owner to look at something and compare it apples to apples. This is what this has, this is what that has. And it is not that way.
Someone mentioned Cato Heritage, and now it's different. Here is what they say. Here is a quote. There is no such thing as a non-Obamacare exchange. And second, creating any type of exchange merely lends manpower to Obamacare federal takeover. States should review.
From the year 2000 to 2007, health insurance premiums for Missouri working families skyrocketed 76%. In the same 7-8 years, Their median earnings of Missouri workers increased only 17%. So health insurance premiums rose 4.4 times faster or higher than workers' earnings. The consumers my organization represents are your constituents. They're the people you represent as well. And as you consider this issue, I hope you will think about them, and maybe even in terms of the constituent surveys that you send out. And what do you think the answers would be to the following survey questions? Would you like health insurance companies to compete for your business based on the value of the plans they offer? Would you like health insurance companies to use easy-to-understand language to describe their products, what is covered, and costs? Would you like health insurance companies to be limited in co-payments, deductibles, out-of-pocket costs, and premium increases? Would you like health insurance companies to be prevented from dropping your coverage if you get sick? Would you like health insurance companies to be prevented from charging women higher premiums than men? Would you like health insurance companies to be prevented from denying you coverage because you have a disability or pre-existing condition? You and I both know that most respondents to those questions on a constituent survey would likely answer yes to all of them.